What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. In today's video, we're covering the different knowledge and stuff that you can only learn on your job site being an X-ray tech. So some of this knowledge does not come from students or clinicals. It just has to come strictly from like where you work at. Certain stuff may be catered, the knowledge specifically to just like where you're. It's not like a general knowledge. Some of this knowledge, I would say, comes from like working night shift, working day shift. So to give you context, I am a night shift X-ray tech. I've been doing it for 4 years. Pretty well versed in days also because I work a lot of overtime. So I would say a lot of the knowledge is like on your equipment. If it like starts acting up on you, you can ask like some of the other more veteran techs who've been in your department longer how to do it, like how to like fix it, how to adjust it. Or if, let's say, you accidentally ran something under the wrong name or you've kind of like messed up, there's certain like niche things that like only being in your specific place you can teach. Or sometimes when there's overnight, we have a lot of upgrading in our system. So a lot of the times what happens is that stuff goes online, so you have to use downtime. So when you go in this mode, certain stuff doesn't work as properly, or you have to use other programs, or what ends up happening is you'll have to, like push it manually or insert certain stuff like by itself automatically, like some like certain stuff like on your packs or on your actual machine, you'll have to like manually put it in. Let's see what other knowledge. Depending on like the doctors, certain doctors, once again, like they'll want certain stuff done a specific way, or maybe if like, let's say someone falls and they break their hip, like if it's broken, shoot the chest for the pre-op. There's certain stuff like that that will come in time, like that you'll like kind of learn on the site of how to do it. Like this is that, this like certain stuff like that that you can't teach, like unless it happens, you know what I mean? There's certain like stuff like how to duplicate exams. So like if you shoot a hip and a femur, how to like instead of like reshooting the patient, like you can just copy it and slap it on like the other one on the other order, type stuff like that can be done. Let's see what else we got. I would say like workflow. Depending on like certain days, the workflow will change a little bit, and you can kind of like prepare yourself. Like, okay, this day it's probably going to be more heavy, like morning portables. So like you can kind of already kind of start prepping in your mind, like kind of when you're going to go to the floor, how to like maybe like tackle the morning port list. Certain times you can already expect, like if certain times of the year like there's more residents, so you already know maybe like they'll like start ordering more stuff. But like that's kind of like knowledge that will kind of vary. But I will say that sometimes like a lot of the knowledge will only be given to you like if you kind of build a relationship with someone who's already been at your facility longer. Because sometimes like certain people, like they're like, oh, you're already certified, like you already know how to do your job, go. Like I feel like no, there's certain stuff, maybe your equipment doesn't work as properly, or there's certain stuff that like even if being in X-ray tech school, like you won't have the knowledge to know how to do this and that. So I would say just like kind of always be nice to people and always be like, hey, I need help with this, or I need help with that. So all the caters of the knowledge to be acquired from different people, because like maybe one person knows this, maybe one person that, because of all the experiences they've had maybe at their facility, or like all the downtime and all the stuff that I go through at night. If you brought someone who worked only days, they would never, like, they would be clueless how to do it because they never have to do it because, like, the system isn't always down during my times and stuff like that. So, yeah. Yeah, it's pretty where we go. See you on the next one.